Thank you for joining us.
Good afternoon. Thank you for having me.
Good. So if we are ready, guys, I just want to welcome everyone and welcome you on behalf of the Southland Regional Mayoral Black Caucus. And it's an honor that you joined us on our virtual town hall meeting entitled What You Need to Know. What we want to do is provide information directly from our state director of public health, which we know that will be informative, right? So with that said, we want to make sure that it is informative but relaxed, right? So we are here and I think we're ready to go. I think what I want to do is at this time, turn things over to Mayor Roger Pagua. He's from the great town of Markham, Illinois, and he has a few words to say.
Well, good afternoon, everyone, and welcome, Dr. Ezike. I want to say to the Southland virtually, and with the Black Mayoral Caucus of the Southland, South Cook County, and in some places Will County. We're glad to have you as certainly our official for the state, and certainly to visit us and to come to talk to us this afternoon. I just had a couple of things I wanted to mention about introducing the South Regional Black Mayors Caucus in terms of what we are as a group and what our purpose is. I'll just be very brief about it, but I want to mention who all of us are here, and again, so glad for you to be with us. The one thing that Mayor Wells didn't mention when he was saying the opening there was, let's knock out COVID-19. And I could not say it. I got my fighting stuff on here for the Southland, for us to find some normalcy for some of us in life here a year into this. But let me just say this, myself, Mayor Ward is the president of the Southland Regional Mayors Black Caucus. I serve as the vice president. Mayor Wells is our secretary to the board, and Mayor Polk is our treasurer to the South. We have some 16 Black mayors in our group: Burnham, Country Club Hills, Dixmoor, Dalton, Ford Heights, Harvey, Hazel Crest, Linwood, Markham, Matson, Phoenix, Riverdale, Robbins, Sauk Village, and University Park. So we cover a vast amount of territory as Black mayors in the Southland, and our purpose is for social and economic education within communities. We want cultural advancement in our communities as African American leaders and mayors, and these are the platforms that we want the most in our communities that you're going to talk to us about, Dr. Ezike. We're very glad again. Our goals overall are to encourage participation of African American leadership at a larger scale. That advocacy is important to all of us out here in the Southland. We need to talk about resources and our interest in the Southland at all times. And again, that's what these forums are about. Finally, we always want to establish in our goals the partnerships state and regionally with corporation, and definitely along legislative lines. And so these things are just vital to us as mayors and leaders, as African American leaders, to be able to carry those things out. So I wanted to give that intro to all the mayors in the Southland and what our purpose is. And thank you this afternoon. We can't thank you much. And I'll turn it back to our president, Mayor Ward.
Thank you, Mayor. So at this time, I want to try to find something short, a quick bio of Dr. Ezike. That's difficult.
No, don't even worry about it. Don't even worry about it. I just want to get to have people be able to talk. I know our time is so short. I think I only have 30 minutes. So don't worry about that. Let's get to the real talk so that people can get the information they need so we can knock out COVID.
Knock out COVID. So if you want to have an opening statement, Dr. Ezike, and then I'm going to turn it to Mayor Wells for specific questions.
Okay, great. Yeah, again, I really, I'm so excited to be with you. Thank you so much for having me. This is an amazing group, our Black Mayoral Caucus. So I'm proud to be amongst you, and I want to see how I can help. I think the phrase that I got from the Surgeon General was, hopefully if you get the facts, then you'll get the vax. And so we know that COVID has ravaged the Black community. I don't think anybody can dispute that. I mean, you'd have to be from some other planet to not understand how this has really ravaged the Black community. And so just by virtue of that alone, I would think that people would be, running, not walking, to get a life-saving resource that can protect you from getting COVID. But maybe people don't understand that the vaccine is effective. I wanted to start by putting out some of the things that people might question. This vaccine has been given to over 15 million people, just in the United States. And that is probably outdated because the numbers are going up every day. It's been given to over 68 million people, like worldwide, in 56 different countries. So this vaccine has been given broadly, widely across the world. So if it was junk, we would have heard something right now, because we have been giving this out. We weren't even the first country to give it out, and it's already been since December, I think 15th or 16th. So we've already been at this for more than, for 2.5 months. What people might be concerned about, does it give you COVID? There is no COVID virus in the vaccine. So the vaccine cannot give you COVID. Does it have a microchip in it? It does not. Will it interfere with your fertility? It will not. Can you get it if you're allergic to eggs? You can. Do we know that it is effective in keeping you safe from COVID? Yes, it's 95% effective from keeping you from having severe illness. Is there a possibility of having a severe reaction similar to when people are allergic to peanuts? Yes, but let's talk about how much we have seen that. It is about, 3 cases per 1 million doses given. So I don't know, if, people can think about what those numbers are, like about 3 cases per million doses. So those are very, very good odds, right? And the people, even if you do have that reaction, we know how to treat that. That's a simple EpiPen. People who have a history of having those kind of reactions are more likely to have it. And so we'll watch those people closely. But even if you have that reaction, we can take care of that. So that is not a reason to be deterred. People say, well, what if I have diabetes or I have heart problems and I take other medicines? Then you absolutely need this vaccine, because COVID has been worse to people with heart problems, lung problems, smokers, people who are overweight, in addition to people who are elderly. That doesn't mean that if you don't have those things, you're straight. We have had people of all ages and no medical problems that have also had a horrible time with this COVID. So I just want to lay that out, because I know maybe that'll take away some of the questions that people may have had, but otherwise I'll turn it over to you to see what other things are on people's mind.
Okay. Well, thank you, Dr. Ezike. You actually did cover some of those questions already. So you're kind of ahead of us. I have one question though that I just received was, Mayor Lightfoot took the vaccine the other day, and it was, of course, to demonstrate to the people in her community that the vaccine is indeed safe. Has there been any discussion about doing the same with suburban mayors?
No, we absolutely would appreciate any kind of opportunity. Right now, remember that it's already available for individuals who are over 65. And so I know that there are people, you guys all look too young, so maybe none of you would qualify, but if we could find some mayors from the caucus that would qualify by the age, and that we could, if you could do a press event around it, I know the media would be interested in it. I know your people, your constituents want to see that, our leadership supports this and is engaged in this, and that they believe in it too. So absolutely, we support that. And if there's any way we can coordinate that with the local health departments so that we can set that up, that's an important message that everybody needs to see.
Yeah, I'll hop in here really quickly just for Mayor Ward and Mayor Akpaw and Mayor Wells to feel free to work with me directly as I can work in conjunction with Dr. Ezike and the good folks at IDPH to absolutely set something like that up.
Wonderful, wonderful.
Okay, we will definitely do that. I think we want to make sure also that we're aware that there are some sites, vaccine sites in the Southland now. Wanted to make sure that we mention the one in Fort Heights at the county center.
I used to work there.
One just yesterday, I think, in Tinley Park that opened up, and last but not least, there's one at the Robbins Clinic on 134th and Kedzie. So, and we are encouraging everyone to call in 833-308-1988, 833-308-1988. So there are some in the Southland area, and it makes it more convenient for you guys to get to those locations.
Okay, very good. Another question I received is the idea of seniors. Many seniors have limited access to technology. Many of them don't have the ability to go online. Has there been discussion on how we can better reach those seniors to make sure that they are able to make reservations through the various sites? Because one of the concerns is that it's a very slow process. You wait on the phone for a long time, or you try and get on the internet, and it's not necessarily feasible. So, any suggestions on what we can do there?
Yeah, very, very important topic. I have talked about this with my team for a couple of weeks now, because we do understand. I've been working with the Department of Aging, people who work with seniors, and saying that that's going to be, a thing. Not everybody is, super tech savvy. So there are a couple of options. One, obviously, we hope that some of these seniors do have either trusted, children or grandchildren who can support that effort, because they know how to sit down there and do all that stuff. So hopefully that's an option. Or if it's not a family member, maybe it's a friend. But we are trying to create, whether it's for the retail pharmacy or if it's for the local health department that's having these events, that in addition to the links to go online, that there's also a phone number. But it's not just having a phone number, it's having a phone number that's answered or that somebody gets back to them. And so we need to, we are pushing more money out to the local health departments, and we are saying that some of that money has to be used to get more people who can answer the phone, that can help walk somebody through this, that we really want to have a whole system where people who can't get it done electronically have a way to call and have someone support them through that process. So that might involve community-based organizations who can be that support to the seniors, but we are absolutely keyed in on that important issue and are working through some available options. And the pharmacies that we've talked to have said that they also will make phone numbers available for some of their services. But we understand that's an issue, and we are addressing that. But in the meantime, get those kids to work. Get those kids and grandkids to work.
Sure, with those grandkids, yeah, very good, very good. Yeah. Okay. Another question. There's a concern about the government and the government's rollout of the program, and so the question is: has there been any thought about letting local communities handle some of the vaccines somewhere down the line? Example would be vaccines in a community, but letting it be dispensed through the fire department with paramedics doing the dispensing of the vaccine. Is that something we're looking at down the line, or?
No, if the paramedics, if the firemen come and say, we have this ultra cold freezer, we want to do this, we want to be responsible for putting all the information into the system. It's a lot involved with doing this. And so, the people who are allowed to do it, they had to go through the process where they can show that they can handle all the pieces, whether it's storing it, keeping everything, having logs on their temperatures to make sure that the freezer or the refrigerator never goes below a certain temperature so you don't waste this vaccine, making sure that you're going to have access to the state registry and get everybody's name, number, date of birth, address. All of that has to be inputted into the system within 24 hours. So it's more than just saying, here's some vaccine, go for it. But if people are willing to do all that, and they can sign up to be a vaccine provider. The issue right now, and you did mention that this was down the road, is we don't have enough vaccine. And I just want to put this in really concrete terms, because people are saying, hey, I'm 65, give me my vaccine today. And unfortunately, everybody's not going to be able to get it today. When we opened up on 2 days ago with, January 25th, we said everybody over 65, and then all these, some of these frontline essential workers, that opened it up to over 3 million people. So that's a lot of people waiting on that vaccine. And so you would say, okay, well, how many did you get this week? It's not 3 million, okay? It's not even 1 million. I mean, to tell you the truth, it's 125,000. So if you do the math on that, you could be eligible, which you are, and not be able to get it today, tomorrow, next week, next month, the month after that. It's just going to take a while. And so everybody has to understand that and continue to be vigilant, continue wearing their masks, keep themselves safe, because I really don't want anybody to get sick right now when we are close to getting that vaccine and getting protected. This is not the time to let your guard down, go get sick when we were so close.
So Dr. Ezike, can you follow up on that just a little bit? So earlier, as we were watching, we saw President Biden on the television talking about more rollout, more production. Any word or anticipated dates on when some of that will begin to happen?
Yeah, so we did hear that he has ordered an additional 200 million doses, but that will not be, I don't know if you gotta listen to the fine print and read the fine print. That's not going to be available till the summer. Okay, so we've got a little bit of time before we hit the summer. So what we hope that there will also be is maybe other vaccines that are still going through their clinical trials, maybe those will get approved. And so those vaccines might be able to come on, but we don't, they got to finish the trials, then they have to submit their whole report to the Food and Drug Administration. Then the Food and Drug Administration has to say, yep, this vaccine looks safe. It looks like it works. Okay, now you can spread this out to the American people. We're not there yet. So right now we just have this little trickle of vaccine that comes in, and then we're like, one for you, Walgreens, one for you, hospital. And so it's just not a lot. So people just have to be patient. But when we get more vaccine, obviously by the summer, but we want to just deal with what we have now and keep vaccinating until there's more. But please make sure that your people understand that, I don't want anybody harassing their local health department, harassing the people at Walgreens saying, it's my turn, I'm eligible. Like they only have what they have. And I don't have the ability to make any in my backyard. So we're waiting on the feds to give us more.
Yeah, and explain that to them, that because a lot of people think that, I want this particular vaccine, I want this, or I want to wait for Johnson & Johnson because it's only one dose. So can you explain that and make sure that, we should get what we can get while we can get it?
You just said it. You better get what you can get when you can get it. I mean, nobody should sit around and say, oh, but I wanted Moderna and I wanted Pfizer. Oh, I'm waiting for the single dose. This is a game of life and death, and we're not trying to be gambling. As soon as your number comes up, as soon as you get an appointment, please try not to miss it for any reason, because rescheduling, everybody's trying for these doses. And I want to especially emphasize that, we're one state, it's Illinois. So, we're trying to prioritize and make sure that people, especially in the Black community where they've been hit so hard by COVID, we want to make sure that they especially get vaccinated. So we are going to be pushing vaccine to, Walgreens and CVS and Walmart in Black neighborhoods. But make no mistake about it, if everybody sits around trying to be cute saying, I'm not sure, somebody else can drive into the community and get it, right? It's that simple. Anybody can sign up for any dose of vaccine. So people need to pay attention and take advantage of it. And don't spend too much time thinking about it if you know you want it, because this is a life-saving resource. And if you sleep on it, somebody else is going to go get it.
That's right.
I wanted to just, towards the end of this, if you would, I want to stay on I don't want to come off the talk of the vaccine, but I would like to ask the question for us as leaders towards the end of this about the give and take, or the trade-off, and understanding what the numbers are in different places to work together with getting the vaccine. Obviously people getting the vaccine, we don't want anybody to get complacent either. Like you said, we're not through this, so we have to still manage on both sides of what's open, what tier level we're at, things of that sort. So towards the end, if you'd address some of that for us of how we can manage as leaders along with the vaccine, would be very good for us, I'm sure.
Let's talk about that, because that's an important part of this pandemic too. So vaccines are one big part of it. So when you get your shot, get the shot. Okay.
Right.
And another important part of it is this mask, right? Because everybody's not, even the 65-year-olds who their time is now, it still may take months to actually get it. So what do you need to do in the meantime? You know, a lot of areas, I think, you know, Cook County and the surrounding counties, a lot of them, the restaurants have started to open. So
correct.
people are thinking like, oh, great, this, you know, pandemic is over. It's not over, right? And every day there's still another 3,000 or 4,000 people that are being diagnosed. And I can guarantee you that of those 3,000 or 4,000 that were diagnosed just yesterday, that a certain percent of those, maybe 1 or 2% of them, will end up dying, right? And so we need to, you know, not have that happen. And so just everything that's available is not necessarily good for you. And so if you go into a restaurant and it looks like they haven't spaced anything out and it's crowded and it's packed and people don't wear masks, that's not a safe environment. So let's just make sure that we apply our good common sense. You know, I know people are interested in trying to dine out, but just remember, any activity that has you taking off your mask and means you sharing air with other people, you cannot tell who has COVID and who doesn't. The person who has it doesn't even know. 50% of people, half of the people with COVID don't even show that they have the signs. So you are really playing, you know, dangerous games, even with your neighbor. You don't know where your neighbor has been and who they could have caught it with. So it's very essential that mask really has power. It really has power. And now that we're talking about these other variants from around the world that are even maybe more infectious, more deadly, this is not the time to be letting our guard down, trying to have parties. I mean, thinking about having these gatherings that we put off. I know 2021 is a new year, but we're not quite done with this virus. And we don't want this virus to make us be done because we gave up too early.
Thank you. Yes.
Mayor Wells.
Okay. We've heard a lot about the now possibly double mask. What is your feeling regarding that, Dr.?
Yeah, so I was putting it out like, you know, for some people are not even wearing a mask, so you need to get it together and start wearing a mask. But you know, if I know that one mask is going to help some of those particles not come to me, then you know that 2 masks is going to stop even more from coming to me. So of course it's important that you're still able to breathe. So, you know, I would, you know, sometimes I have put 2, 3 masks on, especially if I have to go into a setting, you know, like a very public setting that I don't have a choice. You know, obviously I prefer not to go, but some of the places, you know, if I have to go into a hospital, I will put 2 or 3 masks on as long as I can breathe, because I want to have as much protection as I can. But people just need to at least wear something. Putting on your mask is great, but that other person needs to put on a mask too. And so people need to not be shy, you know, because I'll be in a place and I'm walking through and I'm like, and if somebody's talking to me, I'm like, put your mask up and over your nose too. And they're like, you know, and I'm like, yeah, put it on, you know, or somebody will be like, but I'm far enough away. I'm like, I want all the protection I can get. I want you to be far enough away and I want you to put your mask on and I'm going to double mask. It does not hurt to be more careful. The more careful, the more precautions, the better we will be and the better chance we have of not getting infected.
That's right.
Okay. Very good. Well, that was it as far as the questions that I had. Dr. Ezike, I want to thank you as far as we look at the positivity rate in the state of Illinois. I mean, the numbers, when you look at ours, what is it today? Is it 5.5%? Or
so just remember, just 2 months ago, all of us, the whole state was 13%, 15%. There was one region in like closer to, where was that? Maybe Peoria. I mean, it went from 13% to 19, 20%. And now everybody is, you know, 8, 7, 6, 5, 4. So this is a great spot to be. So the reward for, you know, getting it down was that we opened up, which is almost a little twisted because we know what happens when you open stuff up again. But to slow it down so that it doesn't come right back to where it was, go back to 19%, is going to be using our mask, is going to be still using our common sense and saying, you know, everything that's available might not be for me, especially if you know you're high risk. You know, so we have to still keep our distance, still wear our mask, still really try to say no for any kind of gatherings, especially indoor is more risky than outdoor. Anything that has to do with you taking off your mask, be real careful. My kids have gotten slick. Like even if they want to drink, they can put the straw up under the mask so they don't have to take it all the way off. So any modification you can do, that matters. If you're in a car with somebody has to drive you somewhere, that person still could be a risk. And you're sitting in a closed car. That means there's only a little bit of air. And if there's some virus particles in there, there is a possibility of bringing it in. So if you can handle putting the windows down on both sides just a little bit so that there's more air moving it through, that's another thing you can do. Take vitamins, vitamin C, zinc, vitamin D. Those things are important. Take your diabetes medicine, take your high blood pressure medicine, try to control all that you can control. Exercise. There are things that we can do. And so I hope everybody can take advantage of that. But don't be afraid to tell somebody, especially, wear your mask, and be careful even with your own family. People will say, oh, well, that's my kid, that's my cousin, that's my in-law. They could be your family, but they can also still infect you. Many people have been infected by family. Many people have been infected at funerals. They went to a funeral. It's a very tough time. People are hugging and kissing. They feel like they have to. I just have to connect with you. You've been through something. But that doesn't serve you when you end up going to another funeral the next week because of that first funeral. And that has happened in more situations than I can count now, just in Illinois. So we have to be strong. It's a tough, we wanted to flip the switch on 2021 and say it's over, but it's not quite over yet. So we have to hang in there and keep doing the things that have at least allowed us to get this far, but let's not have done all that and then in 2020 let it go before we got the vaccine.
And you're right. That's what we do. I know it in my town, and I know a lot of my colleagues do the same thing. We're always doing more and more, and I do them, God, more times than often. I do mass giveaways, and they're like, "Well, you're doing another mass giveaway?" Absolutely, because people think, "Well, the vaccine." Well, the vaccine is, we're in the beginning stages, and down the line and around the corner and over the hill, the vaccine is going to be great, and it's getting us there. But in the meantime, I do regular mass giveaways, and so do my colleagues, and we have to continue that.
Please. And if you can have your law enforcement, really try to deal with the people who are breaking all laws. If things are all crowded and people are not following any kind of spacing between different parties, people shouldn't be gathered around the bar area. Everybody should be seated 6 feet apart at the bar. If somebody is seeing that it's all crowded, somebody needs to do something about that. This is not about busting people. This is about saving lives.
We've done that. A lot of us are doing that. We're citing them. I believe that some of the owners of these establishments everywhere in the state, that's why the numbers are. I think that they'll be pretty good. I have faith that they will, because I think some people are learning their lessons as well as we're enforcing on our end. They're the ones that are getting the consequences of not doing it. Their businesses are suffering because of it. So I believe that. I think people are finding out, unfortunately, in the hard way. Even some of the families, like you said, at funerals, and we've had to find out how to even, grieve and have condolence with our loved ones in that too. So I think we're heading in the right direction, and certainly this has been very informative to so many of us. Only thing you left out with the vitamins and all that was the rest, because we gotta get rest. We don't know anything about it, but I always think about it. We're always working, but keep that immune up. That's
very true.
That
I haven't been following that advice, but I know it's good. It's good advice.
Yeah. So
I know we're running short on time here, but I just wanted to say thank you to the caucus here. Dr. Ezike knows this, but we're a governor's office of 40 to 50 people. Without our partners, you guys are our mouthpiece, and you guys have been so awesome and so excellent. Dr. Ezike, to put it lightly, is a superhero, but she cannot be in every part of the state at once. And so we rely on you guys to disseminate the message. And you guys have been doing an amazing job. I am here, Mayor Akpawa, Mayor Ward, Mayor Wells, if you guys need any sort of communication with the state, do not hesitate to call at any hour of the night. Luckily, I'm young, so rest may not need apply at this point. And we are looking forward to working together in the vaccine distribution and to help knock this one out. So
Knock
thanks.
it out.
Thank you, guys. Listen, this has been great. We appreciate it. We know, Gabe, you know, I test you on that. I call you day, night, weekends. You know that, and you always respond, and I appreciate that. And Dr. Ezike, we appreciate you, you know, taking the time to share this with our constituents, our residents. It's important for them to see you. It's important for them to see your face. You right, so that they get it. We have to make sure that they get it, and this helps hopefully encourage them that if Dr. Ezike does it, if she can do it, then doggone, how come, you know, why won't we do it? And we're gonna follow your lead until we are done with this thing. So your precious time is much appreciated.
Sir, it's a pleasure and an honor to be with you. Thank you for your leadership.
Thank you very much.
Thank you, everyone.
Yeah.
Bye-bye.
Right.
Okay. Good afternoon, everybody.
All right. Thank you, guys.
Okay, thank you.
Okay. Thanks, guys. Goodbye.
Okay, good afternoon, everybody.